Hi, I'm Dr. Estela Rodriguez. I'm a thoracic oncologist at the University of Miami. And today we'll be talking about what are the biggest challenges in the diagnosis and treatment of small cell lung cancer. Small cell lung cancer accounts for 20% of all the cancers that we see, but it is a really important diagnosis to be made early because it's a more aggressive histology, meaning that patients that present with small cell lung cancer can have symptoms and they need to be identified earlier, because the good news is that they can respond to treatment also very fast. So what is important to know is that some of the symptoms of small cell lung cancer can be misdiagnosed for other things. So sometimes patients present with symptoms that look like pneumonia and shortness of breath, or problems with the heart and shortness of breath. So if you have symptoms that go on, it's important to talk to your doctors. These lesions present centrally, and many of our patients have to be admitted for treatment. Like I mentioned, they can also respond fast. There's also an entity of paraneoplastic syndromes, which are like autoimmune syndromes that are affiliated with small cell lung cancer that also can present early and be misdiagnosed. And some of those can include low sodium, weakness of the muscles, and problems with movement. And those are things that if they don't have an explanation, looking for small cell is also important if you have a smoking history. I think the biggest challenge in the diagnosis of small cell lung cancer is that there's a very short window between patients having symptoms and needing to make a diagnosis, which is very different than non-small cell lung cancer, where you could screen people every year and try to find these lesions early. Small cell lung cancer, because it grows faster, we don't have that. We have a very short window to find this early. So most patients present with large lesions that need treatment urgently, and they need to be treated by an oncologist so that they can be set for treatment, which can include chemotherapy, radiation, and new immunotherapy agents. So there's a lot of hope for patients with lung cancer. And I think the biggest delay for patients is sometimes the stigma associated with smoking, so that many patients that are smoking and have these symptoms, they themselves feel like at fault for their symptoms and they don't seek care. So we really want everyone who has symptoms that are not getting better to seek care, because small cell lung cancer is a very serious diagnosis that needs an urgent treatment and recognition. Some of these patients will require biopsies that are invasive, and the faster that you get to the hospital or to your pulmonologist, will be able to get you on the right course of treatment.